Welcome to the last part of our motor wing of the nervous system, specifically the skeletal motor. So last time we discussed the motor aspect, that is the voluntary aspect and the involuntary aspect of the skeletal movement. So in this segment, we are going to emphasize on the role of the cortex, that is the cortical, of course, in initiating the movement of initiating the motor impulse, and also the role of the brainstem, and also the subcortical structure such as the basal ganglia and the thalamus in controlling the motor function. So this can be largely thought in two ways, just the way we discussed last time. The voluntary aspect that is majorly charged with the initiation of the movement. So this is likely to emanate from the cerebral cortex, and this is actually achieved when the cortex area of the brain is actually activated. So this is majorly focusing on the motor part of the cerebral cortex. Remember, we divided our cerebral cortex into various parts: the sensory and the motor part, and various areas of the cortex that charge with different function. But here we are majorly focusing on the motor aspect. So this should be able to give us the voluntary aspect of the motor movement. And the involuntary movement that is majorly charged with the patterns should be aided by the lower regions of the brain and even the spinal cord. So this includes the spinal cord, the brainstem, the pons, and the reticular. The red nuclei of the brain are very important, but that is in the midbrain. The basal ganglia and the cerebellum. So all these are very important in controlling the involuntary movement of the skeletal muscles, of which we've agreed that it is also very important. So when you talk of the skeletal movement, we know the voluntary part of it and the involuntary part of it, as we discussed last time. Of course, when you are talking of movement, you are majorly referring to the muscles, referring to the muscles. And for the muscles to move, that will definitely require some impulse from the brain and eventually into the muscle. And impulses normally moves in terms of fibers. So many fibers in the nervous system, we can actually talk of represent them as majorly pathways. So there are major pathways or major motor pathways when it comes to the movement of the muscle. So what are the major motor pathways that exist in the brain? So we list them. So we have the direct corticospinal pathway. So we can just write them over here. Direct corticospinal. So remember what we said in the naming. So that means signal emanating from the cortical area of the motor all the way to the spinal area before they join the lower motor neuron that directly communicates to the muscles. So remember the lower motor neurons that we suggested specifically to the muscles. So where we had the gamma and we had the alpha part of the motor neurons. So the direct corticospinal pathway. We also have the indirect that normally passes through the basal ganglia. The basal ganglia pathways. So these actually represent a movement that needs some form of adjustment, so that we achieve somehow a fine motor movement. So you can say example things include things like adjusting maybe the walking speed when moving through, or maybe when moving through uneven ground. We also have the cerebellar pathway. So again, emphasizing the role of the cerebellum in controlling the motor movement. So we'll be able to see it. So we've said that we'll divide our session into basically two parts, where the first part will be emphasizing on the role of the basal ganglia in controlling the movement, the motor movement, and also the role of the cerebellar pathway, the role of the cerebellum in controlling the movement. So the neuronal connection will be represented in these pathways. So maybe just to note, signal that uses normally the direct corticospinal pathway, they do not normally require to pass through the basal ganglia. So these are movement that, or rather motor signal that do not require let's say major modulation. So this include movements that are normally let's say simple, and voluntary movement that do not require significant modulation. So this represents the simple movement. So this could include example things like reflex actions, where an individual just need to act swiftly. So majorly the reflex action or simple reaching movements, just write simple reaching movements. Okay, let's just go straight to the cortex. The cortex, an area where we anticipate the motor signals to actually emanate from. So the cortex has various parts. So this normally occupying approximately the posterior third of the frontal lobe is what we refer to as the motor cortex. So motor cortex, this is where the motor impulse are normally generated before some goes directly to the basal ganglia, goes directly to the spinal cord using the corticospinal, or some goes to the basal ganglia, majority likely to go to the basal ganglia for modulation before they are reverted back to the primary motor cortex, and then joining maybe now the corticospinal pathway. So posterior to the central circles, that you'll find the somatosensory cortex, which feeds the motor cortex by many signals to initiate the motor activity. So just like we said in our basic introduction of the central nervous system, the motor wing normally acts to reply the signals that reaches the somatosensory area. So getting signal from the sensory wing, the brain processes, then the brain decides to act. And the brain normally acts using the motor wing. So that is, of course, majorly respecting the skeletal aspect. So the motor cortex in itself is divided into three sub-areas. So we have the primary motor area. So we'll be able to see the exact role of the primary motor area. We have the premotor area of the motor cortex. We'll again be able to see the exact role, and also the supplementary motor area. But grossly thinking, or grossly speaking, somebody should be able to say that this area should be able to give us at least motor impulses, so that eventually our muscle is able to move. But we know that the movement, or rather the impulse, will not just move directly from the motor area to the muscles. It needs to pass through some areas of the brain for modulation. For now, we know the role of the basal ganglia, as we are just going to examine it a little bit. and also how the cerebellum will be very important. But just sticking to the motor, or rather to the motor cortex, we've said that the motor cortex, we have the premotor, we have the supplementary, and we have the primary motor area. So just with some form of image. So let's just use the image that is there on top. So we are seeing the somatosensory area of the brain, or of the cerebral cortex. So just we highlighted with this particular color, that is in close association to the motor area of the brain. The motor area of the brain, we've said, is divided into several parts. We have the primary motor area. The primary motor area immediately anterior to the central sulcus. Anterior to it, there's a premotor area. So the premotor area is immediately anterior to the primary motor area. And we also have the supplementary area. The supplementary area is well viewed medially. So I don't know if you have a good image to show that. So maybe you can demonstrate with this model over here. So even though this one is posteriorly oriented. So we've said that if this is the central sulcus over here, we should be having the primary motor area immediately anterior to it, and posterior to it we have the somatosensory region. So we've seen that anterior to it we should be anticipating the premotor area anterior to the primary motor area, around this area. So, and we also suggested that we have the primary, not the primary, but the supplementary area. So the supplementary area is well viewed in the medial, if you were to turn this cerebral cortex medially. So medially to it, so let's just have an extension of the primary motor area. So medially to it, we'll be able to see the internal structures, or the internal area, the primary or the supplementary area. So this represents the supplementary area. Of course, if you have a lateral view, this will be greatly occluded, but if you advance medially, you should be able to see the supplementary area. So that is our supplementary area. So the three area of the cortex. So the premotor area is very important as part of the motor cortex. So exactly what does it do? So when this area becomes activated, especially in the anterior part, it normally creates a motor image of the action that is that needs to be performed. Then in the posterior motor cortex, premotor cortex, this image excites each successive patterns of muscle activities required to achieve an image. This posterior part of the premotor cortex sends its signal either directly to the primary motor cortex or to the specific muscles to excite, that is the specific muscles, or alternatively by the way of basal ganglia to the thalamus, then to the primary cortex. So maybe what we need to be aware of is that most signals are likely to emanate from the premotor cortex into the basal ganglia, while minority of these signals from the premotor area are likely to go to the primary cortex directly, so that it now uses the direct corticospinal pathway that we suggested. So maybe this is what an individual needs to know. So as we suggested, let's just have a gross image over here. So let's assume that this is a central sulcus. So a central sulcus, posterior to it, we have the somatosensory area. Anterior to it, we have the primary motor area. So we just want to demonstrate how the how neuronal information normally occurs. So we are having the sensory part, the motor part. So this is the primary motor part. Let's just advance a little bit. And let's assume that this is the premotor part. The premotor, the motor, the primary motor. Let's just write the primary motor. And then this one's the premotor. And this is the somatosensory area. So remember, most of the sensory signals, especially from the skin, and a part of some part of the proprioception, as we suggested, even though not significant, are likely to end at the somatosensory. So at the somatosensory area, an individual will be able to perceive this sensation, and upon perception of this sensation, the body will definitely require a motor reply. So we just want to examine how these areas will interact. We have the primary motor area, the premotor area, and of course, if you extend a little bit, we'll have the what we call the prefrontal cortex. So remember, in our introduction, we said that this is the area of the cortex that normally is charged with a lot of intelligent action. So assume that you've had a signal from the somatosensory area, of course using the spinal thalamic tracts that we suggested, but from the thalamus into the sensory area. So there'll need to be a communication of the signals. So let's say we can just use a fair modality. Let's say there's some form of irritation, or maybe there's some form of pain that you are perceiving in a specific area. Let's assume it's a cheek, and maybe a cheek at your face, maybe perceiving some form of pain. Maybe let's assume you are slapped with somebody. So once the signals are there, the mind, or rather the brain, is able to perceive it, and before maybe the primary motor acts on it, the signals need to be relayed somehow to the prefrontal cortex. So the prefrontal cortex is able to appreciate that, of course, there is a slap that has been that the individual has perceived, and there's a pain, and now it needs to make a decision whether to act on it or not. So if the prefrontal cortex of an individual approves of this action, that approve of these actions that want to be effected by the motor, it will send an excitatory signal to the premotor area. So you've been slapped, and now you've decided maybe to have a reply. Maybe the appropriate reply for you, considering the social circumstances that your prefrontal cortex will examine. Of course, it is associating with the other area of the brain, such as the limbic system. So using all that information, considering the social circumstances, deciding on whether to act. So let's assume it has decided to act. So giving some excitatory signals to the specific premotor area. So the premotor area being activated, it can decide to directly activate the primary motor area. So maybe the primary motor area that wants to be exerted at the specific primary motor homologous area, maybe we will want to activate a specific area that represent maybe your hand and other important muscles in the body. so that you also have an appropriate motor reply. So the appropriate motor reply at this case might mean that maybe you will respond by slapping this person back. So the premotor activates the primary motor. So the primary motor, once activated, it is able to send signals using now the corticospinal tract, as we suggested. Corticospinal tract. So this will be seen as some form of direct movement. This is because signals from the premotor just ended directly to the primary motor region, and it was just acted upon, or from the primary motor, the signals were sent using the corticospinal tract. So remember the corticospinal tract, even though we'll be able to see it adequately, so that it ends to the spinal area, interacts to the with the lower motor neurons, so that eventually somebody is able to see the motor activity. So in this case, we are using an example of slapping. So you slapping the individual that slapped you. So you're just replying the sensation that you felt on your cheek. We know there are many alternatives. So if it's not socially appropriate, you employ your intelligence. So it might equally give you, it might equally sense an inhibitory feedback, so that the premotor does not act and it does not relay signals to the primary motor. We've said that most of the time, the premotor area, it's not just likely to send signal directly to the motor. So it is likely to send signals first to the basal nuclei or the basal ganglia of the brain. So that movement or motor movement or signals are modulated before they are eventually transmitted to the primary motor area for good motor reply. So we'll just have a look at it. So just before we go to the basal ganglia, let's just a little bit appreciate maybe the role of the supplementary area of the motor. So this is also a very important area of the motor. So in that, contraction elicited by stimulating these areas are often bilateral rather than unilateral. For instance, stimulation frequently leads to bilateral grasping movements of both hands and simultaneously. These movements are perhaps rudiments of the hands' functions required for climbing. So for climbing, you need simultaneous contraction for you to be able to achieve that type of motor activity. So in general, this area functions in concert with the premotor area to provide the body wide attitudinal movements, fixation movements of different segments of the body, positional movements of the heads, eyes, and so forth. So this area is also very important. So there are also other specialized area of motor control that is normally found in the human motor cortex. So this includes the Broca's area that are very important for speech, especially how the mouth is actually moving, the lips. Voluntary eye movement field, so there's a specific area in the cortex that controls it. The head control, or rather the head rotation area, and also area of the hand skill. So we've said that signals from the premotor cortex, most of them are likely to pass to the basal ganglia. That is before they return back to the cortex, where at least they can now be transmitted all the way down to the spinal cord. So this represents the basal ganglia with various important parts that you'll be able to see. So I just want us to explore a little bit of some of the available pathways that are normally there in the basal ganglia. So there are normally three pathways. So pathways representing how signals are likely to move within the basal ganglia, and of course from the cortex and eventually back to the cortex. So we've said that ordinarily when we want to initiate a movement, the premotor cortex might send the information to the primary. From the primary, the information will just be will descend down directly using the cortical spinal tract. Even though most of the time that motor signal normally needs to be modulated with some form of appraising a specific pattern, especially when it comes to movement. So most of them are likely to pass through the basal ganglia. So we have various pathways within the basal ganglia. We have the direct pathway, we have the indirect pathway, and we have the hyperdirect pathway. So just within a short time, we'll be able to see what this really means. So the direct pathway is actually very important. So we can just write over here, direct pathway. So remember, these are representing cortex, or rather the motor cortex, sending signals to the basal ganglia, to the thalamus, and eventually thalamus communicating back to the cortex. Just like what we had preempted with the thalamus is a very important relay unit. So information are not just likely to flow to the cortex just directly without passing through the thalamus. So grossly, somebody might want to think of this as a gate that allows information to pass to through the cortex. So this the direct pathway. This is our number one pathway that we'll talk of in the basal ganglia. So this normally promotes movement by reducing the inhibition of the thalamus, leading to the cortical activation. So you need to remember that it promotes movement. So we'll be able to see how it promotes movement. So maybe before looking into that specifically, maybe you might shift your attention a little bit to the thalamus. So the thalamus normally communicates back to the cortex, specifically the primary cortex area. The primary cortex area. So it normally sends some excitatory signals to the primary cortex. So these pathways seeks to examine what kind of impulse will our thalamus generate. Are we going to activate our thalamus excessively so that it sends some excitatory signals, or are we going to reduce the excitation so that the signals again reduces? So this movement within the basal ganglia, they can either increase the intensity of the excitation, or they can reduce the intensity of the excitation, just what we are just about to examine. So what happens in the direct pathway? Of course, signal will need to come from the premotor cortex. So our first step, signals are coming from the motor, or rather the premotor cortex. And I hope you are able to see. So this represents the cortex. So the gray, the darkish areas are representing the cortex. So signals from the cortex. So let's just pick any area. So assume that this is a primary cortex. So signals from this area will excite the stratum. So in the basal ganglia, there's a part we call the striatum. So striatum represents the caudate nucleus and the putamen. So the cortex or the premotor cortex sending some signal to the striatum. So remember, these are likely to be excitatory. Not likely, they are normally excitatory signals by a neurotransmitter by the name glutamate. So these are glutaminergic neurons. So the primary signal from the primary cortex all the way down to the putamen and caudate. So this is referred to as the striatum. So let's say from the primary cortex to the striatum. So once the caudate and the putamen have been activated, so the striatum, once they've been activated, so the striatum normally sends some inhibitory signals. They normally send inhibitory signals to the globus pallidus. So this is also part of the basal ganglia. So we can see the image over here. This represents the globus pallidus, the two nuclei that you can see, the darkened areas. On this other side, the same too. So let's stick on this other side. So they send signals to the globus pallidus internus. So we have two globus pallidus. So we are having the externa on the external part, and we are having the interna on the internal part. So signal from the striatum. So let's just combine them so that we have caudate and putamen. So signal from this port will be relayed into the internal, into the globus pallidus internus. Globus pallidus internus, and not only being relayed to the globus pallidus internus, but also relayed to the substantia nigra. So we can be able to see the substantia nigra over here. So just like the word suggests, it's a substance nigra, meaning somehow black. So the darkened area in this particular spot. So the specific, we also have two types of substantia nigra. So we can have the pars reticulata and pars compacta. So the signals are likely to end at the pars reticulata. So we can just write substantia nigra in brackets pars reticulata. So we write the name par. So we have par reticulata and we have the par compacta. So we saw this was an excitatory by use of glutamate, but when the striatum will send signals to the globus pallidus internus and to the substantia nigra reticularis, and this normally uses these are inhibitory signals, as we've suggested, and they are likely to use the gamma aminobutyric acid, the GABA. So the reason why we are demonstrating this, it is just to acknowledge that there's normally an electrical network that normally exists. So we just want to see how the modulation is just taking place. So when you send an inhibitory signal to the substantia nigra and globus pallidus internus, that will mean that this nucleus will be reduced. The excitation will be reduced, and when they are reduced, we'll say that both globus pallidus internus and substantia nigra reticulatus are inhibited, and when they are inhibited, it means that their effect on the thalamus will also reduce. So their effect on the thalamus will reduce. So that is to mean that the globus pallidus in turn can sprout out signals to the thalamus. So this is the thalamus, and the substantia nigra normally sprouts out signals to the thalamus. I think it would have been more appropriate if we would have used a broken line for the inhibitory. So maybe assume that this from the striatum to the internal globus pallidus and to the reticulata substantia nigra are inhibitory. So once the inhibitory are sent, it means that the globus pallidus internus will be inhibited, and this will be inhibited, and in charge they will not be able to send their signals. So remember, their ordinary signal are normally inhibitory by use of the or again by use of GABA. So when the inhibition of these two nuclei stop, that means that we'll have our thalamus being active, because it is not receiving the inhibitory signal that it normally receives. So that means the activity of the thalamus will increase. So when the activity of the thalamus increases, so ordinarily the thalamus normally communicates back to the cortex. So the specific area of the cortex, so let's just write a continuous line, because this one is an excitatory. So from the thalamus, this will be able to give us an excitatory role. So it is good to know that the direct pathway normally facilitates movement. And we are able to see that because the end goal result of the direct pathway is actually to excite the thalamus even further. So when the thalamus is activated, it means that the movement will increase. And maybe for just clarity, we suggested that signals do not need to move. Most of the signals need to move from the premotor area into the basal ganglia for modulation. So what do we mean by modulation? So whenever there's a motor signal that enters the basal ganglia, so the basal ganglia should be able to increase the intensity or reduce the intensity. So the increasing and the reduction of the intensity of that movement is what we are referring to as modulation, where you can somehow increase. So increasing is normally via the direct pathway, or you can decrease using the indirect pathway that we'll just examine in a minute. So we should be able to stick with this particular demonstration. So that represents the indirect pathway. And maybe just to add on that, in the indirect pathway, there's normally some form of modulation. The form of modulation by the dopamine. So that means our striatum over here, we have the striatum, the putamen, and the caudate and nuclei. Normally receives some modulatory signals from the substantia nigra pars compacta. So let's remember this. The pars compacta. So they are likely to send some dopaminergic neurons to innervate the striatum. So innervating at the putamen level and also the caudate level. So this normally releases dopamine. Dopamine is normally released that interacts with the various receptors that are available in the putamen and the caudate. So these are normally the dopamine 1 receptors, D1. So let's just write D1 receptors. So once the dopamine is released, it normally binds to the D1 receptors in the striatum, and this enhancing the direct pathway. So the dopamine released in this context will enhance the direct pathway, as we've just seen. So provided we inhibit our globus pallidus internus and substances nigra, that means our thalamus will just be free, and it will be able to execute its excitatory role to the cortex. And remember, this is now the primary cortex. Now we've modulated our motor signal as we were passing through the basal ganglia, the thalamus. Now we are assuming we are returning that information in a tuned way. That means that we've been able to gauge the right intensity of movement that is required. So some movement that are not required will be inhibited. So the inhibition comes through these other pathways. So we said that we normally have three pathways, that is. So the second pathway that I want us to discuss is the indirect pathway. So let's just write over here, indirect pathway. We'll just see why is it indirect. So just remember that this is direct. So again, the same story starts in the cortex, possibly the premotor, as putting out fibers. So we've suggested that this is normally somehow an inhibitory. There are some movement that might not be wanted, even though you want to initiate. This can be more seemed. Ignore that. So the indirect pathway are likely to inhibit some unwanted movement. So not every movement will be wanted. So the same communication. So that means motor signal will emanate from the premotor cortex straight to the striatum. So remember, the striatum representing the caudate. So this time round will be keen. So this is an excitatory. So remember, it is a straight. The caudate and the putamen will be activated. So once these are activated, that is the striatum. They inhibit the external segment of the globus pallidus. So this direct communicates with the globus pallidus externa rather than the interna, as we were able to see with the other pathway. So it should be an inhibitory signal. So remember, the striatum normally puts out an inhibitory signal. So just how I think it's because this area is too small. I wanted to use a dotted line to represent an inhibitory. So we are sending signal to the globus pallidus externa via and this is an inhibitory signal. So remember, the inhibitory neurotransmitter of choice is gamma-aminobutyric acid, the gamma. So the inhibited globus pallidus externa reduces its inhibitory effect to the subthalamic nucleus. So that giving you a clue that the globus pallidus externus is normally connected to the subthalamic nucleus, and it normally sends an inhibitory signals. So what happens? The inhibitory effect to the subthalamus nucleus will reduce. So if it reduces, it means that our subthalamic nucleus will become a little bit active. So active meaning it is able to sprout out an excitatory connection just the way it normally does. So the subthalamic nucleus is normally connected to the substantia nigra reticulatus. So remember, this one is indirect. As the word suggests, we did not come directly from the striatum to the globus pallidus internus and the substantia nigra reticulata. We had to pass through the globus pallidus externa, use the subthalamic nucleus, and eventually arrive back to the globus pallidus internus and the substantia nigra reticulata. So from here, because this is now excited, so we are able to send excitatory signals from the subthalamic nucleus to the substantia nigra, specifically the reticulata, and again some of the excitatory signals, so that we excite our globus pallidus internus. So once these are activated, so remember, this normally sends out an inhibitory signal. So once they are activated, it means we'll be enhancing their inhibitory capability. So spreading their inhibitory signals to the thalamus. So that is the globus pallidus interna. So this time round they've been activated, unlike what we saw in this particular area, because if you send signals direct from the globus pallidus, rather from the striatum straight to the globus pallidus internus and the substantia nigra reticulata, it will inhibit it. So even the inhibitory capability will reduce, giving the thalamus now a time, giving a thalamus a chance to be more active. But in this case, now that the globus pallidus internus is activated and the substantia nigra reticulata is activated, they are able to competently send out their supposed inhibitory signals to the thalamus. So this will mean one thing: our thalamus, because of the inhibition signals that are emanating from the globus pallidus internus and the substantia nigra, it will its activity will reduce. So its normal excitatory action to the primary cortex will reduce. This is because it is receiving more of inhibitory input, unlike the excitatory that it should be receiving. So the general results are likely to be seen at the thalamus. So once the thalamus activity has gone down or reduced because of getting much of the inhibitory signals from the excited or from the activated substantia nigra reticulata and the globus pallidus internus, so that reduces activity. Unlike what we saw with this, because our substantia nigra was somehow depressed and globus pallidus internus were somehow depressed by the inhibitory signals that were emanating from the striatum. So as a result of that, the inhibitory signals were reduced and our thalamus did not have any inhibitory threat, and so it just went ahead with its excitatory role. So maybe what you are noticing, it is the role of these neurotransmitters, the glutamate and the dopamine. So just like in the direct pathway where we had the substantia nigra compacta, the substantia nigra compacta is also very important in modulating the activity of the striatum. So that means it is able to sprut out dopaminergic neurons. So let's assume this is the substantia nigra compacta, giving the dopaminergic neurons to the putamen and caudate. Of course, this now representing the striatum, as we've agreed. So this normally release the dopamine in the striatum, inhibiting the indirect pathway. So once dopamine when dopamine are released, so remember, just in gross speaking, dopamine is normally an inhibitory neurotransmitter. So in this case, if it inhibits the striatum during the direct pathway, it will mean that the inhibition of these other neurons will reduce. While when it inhibits this, it means that the thalamus again is likely to not the thalamus, but signals from this particular area from the we are likely to excite to reduce the inhibition signal to the globus pallidus externa. So the dopamine will be released and it will interact with some form of dopamine receptors. So in the indirect pathways, these are normally D2 receptors. So these are very important, especially maybe in when we'll be talking about the extrapyramidal side effects. So what happens when the level of dopamine increases? So we see how it's likely to modulate this movement. So generally, it is going to enhance, it is going to inhibit the indirect pathway. And for that reason, dopamine is going to increase, or rather increase the movement. So you increase dopamine in this pathway, because in this pathway, it will enhance the direct pathway, increasing the movement. In this area, it will suppress the indirect pathway, and the end result again is increasing, or rather facilitating, the movement. So lastly, we have another pathway that is very important. So we've said that we also have another important pathway by the name hyperdirect. So this is the third pathway, hyperdirect pathway. So we said that the direct pathway normally enhances movement. The indirect normally inhibit movement. So for this one, what it's likely to do, it normally suppresses movement. Suppresses movement rapidly. So you're able to see why we are calling it hyperdirect, or maybe suppressing the movement. So again, the same story just repeats itself. Signals from the cortex, the premotor cortex. So this is normally regarded as hyperdirect because it normally bypasses the striatum. So the pathway does not pass through the caudate and putamen, but rather goes straight to the subthalamic nucleus, and of course using the glutaminergic neurons, meaning it releases glutamate at the end. So it normally excites the subthalamic nucleus. So once this has been excited, so just like what we saw with the indirect, that after the excitation of the subthalamic nucleus, so this is able to send signal to the substances nigra reticulata and the globus pallidus internus. So remember, these were very important area because once activated, they send inhibitory signals to the thalamus. So let's see just what happens. So once activated, these are able to send excitatory signals to the globus pallidus internus. So these are representing the cell body, and this the axonal end. So once these are activated, so remember, so this our subthalamus or our subthalamic nucleus normally sends an excitatory signal. So sends excitatory signals so that this becomes active. But once they're active, they normally send inhibitory signals to the thalamus. So what does this mean? Activation of the globus pallidus internus and the substances nigra reticulata will enhance the inhibition capability of this nucleus, so that the functions of the thalamus is depressed. So what are we depressing? We are depressing the excitatory signal that normally emanate from the thalamus back to the cortex, specifically the primary motor area, before this information is again sent using the corticospinal. So this is regarded as the hyperdirect. The end result of this will result in the in suppression if you are able to follow the logic. And in this case, the dopamine has very minimal role in the hyperdirect because even if our substances nigra compacta releases dopamine to interact with the glutamine alkyudate, it will not be able to do anything, because remember this the striatum or glutamine alkyudate are not an important part when it comes to the hyperdirect pathway. So just in summary to what happens, we've seen that movement from the cortex, specifically the premotor cortex, where the image of an intended action is normally sent to the specific primary area of the brain for the motor execution by relying of that the relaying of the motor signals. But in most of the cases, the relay do not just happens directly. It needs to pass through the basal ganglia for modulation. So modulation, you are able to kick out the errors in terms of excessive movements. You are able to limit those movements excessively, or you are able to excite some movement that that will have been under suppressed from the word go. So that's why we were talking of symptoms of tremor when we are having fine tremors, when you are having some disease processes in the basal ganglia. So maybe as an extension to the pathology, it will be very important for us to acknowledge some of the clinical circumstances that you can anticipate whenever we are having an issue with the basal ganglia. So I'll just mention two. We have the Parkinson's, Parkinsonism or Parkinson's disease. So this normally happens when we are having damage to the substantia nigra. Specifically, let's talk of the compactor. So that means in this state, you are not able to release the dopamine. If the substantia nigra is damaged, you are not able to release the dopamine. So if you are not able to release the dopamine to interact with either D1 or D2, we saw the role of the dopamine in as much as it can inhibit this area to allow the inhibitory action of the striatum. Eventually, what it normally seeks is to facilitate movement. So it means that movement will be greatly depressed. So you can have symptoms will be due to underactivity of neurons. Underactivity of the neurons that are emanating from the thalamus. So remember, all this it will affect this other area. So thalamus is no thalamus. Dopamine was not in the major pathway, but it somehow seeks to modulate. By modulation, meaning that it can increase the direct or decrease the direct pathway. So, but what you are seeing, it is increasing the direct pathway, and for modulating this other pathway, it is reducing the indirect. The sum effect is likely to increase the activity of the neuronal impulse, that is specifically the motor. So when it's not there, you expect some underactivity. So these people might present with things like bradykinesia. So that means they are slowed in terms of movement and some form of rigidity. So Parkinson's disease is one of them. Another clinical syndrome that can be evidence is Huntington's disease. So this normally occurs when there is the degeneration of the striatum. So with the degeneration of the striatum, so meaning that we do not have an adequate amount of putamen and caudate. So that means we'll be expecting some problem because the main aim of the putamen and caudate is to send inhibitory signals to the either globus pallidus internus or to the subthalamic nucleus. So if the striatum reduces, it means the inhibitory capability of it reduces, and here you will be expecting some form of unwanted movement emanating, because the striatum, remember, is very important, because once signal pass through the striatum, it is able to inhibit some of the unnecessarily wanted movement. So when it's not there in adequate amount, it means that some will just bypass, and clinically it might be seen some like some unwanted excessive movement. So these are normally regarded to as chorea, clinically regarded as chorea, representing excessive movements. Because when you're having an intention to make a movement specifically with your hand, so there is need for it to pass through the basal, through the basal ganglia. So when you're having a disease process, specifically at the striatum, or when it fails to pass, it means that the excessive movement that were there from the word go might still be there, where it is likely to be seen as tremor. That's why we've been emphasizing that the basal ganglia normally fine-tune some form of movement so that it doesn't seem as if this person is having some tremble or tremors, even though it is not likely to be seen with the eyes, though. You know how to assess for the fine tremors, unless very extreme. Sometimes it can be seen, but sometimes it can be missed most of the time. That is in Huntington disease. But also to mention, we also have things like hemibalismus. This normally it can be acquired when the subthalamic nucleus has a disease process that affects its capability. So this represents the first, our first segment of the motor control. So the motor pathway, we say that we have the direct pathway, where signals from the premotor does not need to pass through the basal ganglia. They just go to the primary motor and then descend all the way. So we have the basal ganglia. So in our next, we'll be examining the role of the cerebellum in this kinds of movement, where you will also be able to jot some of the available pathways from the cortex from the cerebral cortex to the cerebellar cortex or cerebellar cortex. So most likely to use the pontine, from the pontine into the cerebellum. Cerebellum might come from signal from the cerebellum might come straight to the thalamus, back to the cortex, or sometimes through the red nucleus to the thalamus and then back to the cortex, especially those movements that has some form of errors and need corrections, so that the cortex corrects them and then sends again appropriate signals. So if appropriate, through the red nucleus, so you remember the rubrospinal, it can just spread that information down the spinal cord and again interact with the lower motor neurons. So just a break.